You are audible.
Thank you. Today, we are honored to have with us Dr. Shravan Nadkarni, a leading expert in oncology who will guide us through crucial insights on early detection, risk factors, and preventive strategies to help us safeguard our health. Before we begin, a few quick points. This is an interactive session, so please feel free to drop your questions in the chat box at any time. And we will have a dedicated Q&A round towards the end where Dr. Nadkarni will address your queries. And now, without further ado, let's welcome Dr. Shravan Nadkarni, a senior surgical oncologist with University Gold Medal for Outstanding Resident Surgeon from the Tata Memorial Center, Mumbai. He is a leader in surgical oncology. With expertise in minimal access surgery and a strong research background, he blends precision with innovation for superior cancer care. Today, he will be sharing insights on cancer prevention, recognizing early warning signs, and the steps we can take to reduce our risk. I encourage you all to make the most of this session. Over to you, Doctor.
Thank you so much. Thank you for the warm welcome and the introduction. I don't deserve such high praise, but I understand that today is a very important day for cancer prevention, cancer detection, and spreading awareness in general. So, excuse me. The theme for this year's World Cancer Day is United by Unique. And what that means is that we have noticed that every patient is unique, every patient's story is unique, and no two cancers are the same. So, this is an extension of the previous year's theme, which was closing the care gap. So that what that meant was now we had a large population which was not able to access high quality cancer treatment, high quality medical care. So that theme was in keeping with closing that gap. But now this year's theme by the UICC, that is the Union International of Cancer Control, which is the apex body of cancer in the world, has put the theme as United by Unique. Let me start off by understanding, since you mentioned it's an interactive session, do our participants have the opportunity to talk during the discussion, during the interaction, or do I continue talking first and then we'll have the questions?
You can continue talking first, I guess, and then we will take the questions from the chat box.
All right.
Yeah.
All right. So, how many of us know what cancer is? Because let's start with the basics. So, most of us think that cancer is one disease. So, it is actually a conglomerate of many diseases, so to say, because cancer can afflict any part of the body. It can be the head and neck, it can be the breast, it can be the chest, which includes the lungs, the esophagus, the abdomen, stomach, gallbladder, pancreas. Every part of the human body can be afflicted by this disease called cancer. To put in simple terms, cancer is when a cell of the human body starts multiplying without control. So, usually, when there is cell division in the human body, it is under tight regulation. When this regulation is when the regulation is not available or not active on one particular group of cells, that takes the form of a tumor. So a tumor can be benign or malignant. Benign is where the tumor does not spread to distant organs like the liver or the lungs or the bones and stuff. Whereas malignant is where these cells are able to achieve autonomy. They're able to achieve nutritional facility through the body, for example taking blood vessels and getting nutrition and start becoming self-sufficient, and that is when a tumor forms and that kind of spreads. So that is malignant tumors, right? So let's come to the theme of this year. This is about cancer prevention and early detection and how to do it. See, I am a cancer surgeon. I treat cancer. So my role comes after a cancer has already developed. It has reached a particular stage, and then we are trying to roll back the problems or trying to address those issues. But as you all know, prevention is always the best. Prevention is better than cure. Although cancer cure, cancer treatment is not what it was 10, 15, 20 years back. We have significant evolution that has happened in cancer treatment. We are able to treat cancer better. Cancer patients are able to live longer, and the quality of life has significantly improved. There was a time when the surgery was successful, but the patient was not, the quality of life was poor. But now there is a very good sense of having a good quality of life and giving the best outcomes, which includes survival, which includes oncological clearance and outcomes, and a low recurrence rate. Of course, this varies with different subsites, that is, with different organs. So that's how cancer treatment stands today. So, firstly, let me talk a little bit about what are the early warning signs. So, I'll talk based on the subsites. So, you first have the head and neck. One of the most common cancers in India today are head and neck cancers, and they are predominantly related to tobacco and alcohol consumption. Unfortunately, there is no safe limit to either of them, either tobacco or alcohol, because there is this myth among general population that I smoke once in 6 months, or I drink once in 6 months, or once in a year, and that is safe. Unfortunately, no. There is no safe limit. I need this message to go out to all of you that there is no safe limit to tobacco or alcohol consumption. Please, please, please try and avoid them, because they are the sure shot preventable cause of head and neck cancers. Apart from head and neck cancers, tobacco and alcohol also have effects on the entire body, including the urinary bladder, which has absolutely no connection with smoked tobacco. But even then, we see a lot of bladder cancers happening in previous smokers. We see a lot of liver cancers in smokers. So there's absolutely no connection. When I say smoking can cause lung cancer or head and neck cancer, it is fathomable. But when we see that patients develop bladder cancer, urinary bladder cancer, kidney cancers, so what that means is putting these metabolites into the system is itself one of the reasons why cancers develop. So there is no safe limit for tobacco or alcohol. Please, if you have had the habit of consuming tobacco or alcohol, I think today is a good time to, start kind of cessation with an ultimate goal of stopping. So the early warning signs of head and neck cancers are either a lump in the neck, something which does not go away. It might be painless, it might be painful. You might have some lesions in the oral cavity, which can be a whitish patch, which is called leukoplakia, which can be a reddish patch, which could be also called as erythroplakia. And there could be an ulcerative lesion, that is, an ulcer or a wound in the mouth, which does not get better even after 2 or 3 weeks. Having mouth ulcers is common, having mouth ulcers is normal, but they usually heal within a week to 10 days. These are called aphthous ulcers. They are usually benign and they don't really take the form of malignancy or cancer. An ulcer which does not go away for more than 10 days or 15 days will have to be checked for the presence of malignancy. Any other symptoms like hoarseness in voice? So you have a change in the quality of your voice recently that has happened, or there is some breathing difficulty. That is another possibility. There is some vague headache which does not go away. The headache is there for a very, very long time, does not go away. There is some breathing difficulty. There is a lot of snoring that happens. So sometimes there is something called nasopharyngeal cancer, where there is a tumor at the back of the nose, which can cause a lot of snoring, which can cause breathing difficulty. All these symptoms can, herald the development of a malignancy. I don't say that these symptoms definitely indicate the presence of a cancer, but if these symptoms are present, then getting evaluated by a doctor, relevant doctor, probably an ENT surgeon would also be fine, or a head and neck oncologist or a general surgeon would be a good idea. Then we come to esophageal cancers coming down in the body. Esophageal cancers, patients present with difficulty in swallowing. So most of my patients that I see with esophageal cancers come with complaints that they're able to swallow liquids well, but जब भी रोटी सब्जी दाल वगैरह कुछ खाते हैं, they have something like a lump in the throat, so they are not able to swallow well. And whenever there is any cancer of the GI tract, that is the gastrointestinal tract, that is the digestive system, the first thing that gets hampered is the nutrition, because one, you're not able to swallow well, you're not able to eat well, you don't feel hungry, there is a loss of appetite, and over a period of time, patients start losing weight. So any unexplained weight loss. So it should be unintentional, it should be unexplained, and of more than 10% over a period of 6 months is what is defined as loss of weight. And this is one of the symptoms of GI tract malignancy. So unexplained weight loss, having difficulty in swallowing, loss of appetite, poor nutrition. So as I said, any problem with the digestive system, the first thing that gets hampered is nutrition. So over a period of time, patients tend to start losing weight. They're not able to eat well. These are the early warning signs of possibly esophageal issues. Then we come to stomach cancers, which are similar to the esophageal cancers. Liver and gallbladder cancers, patients can present with jaundice. So unexplained jaundice again. So I see a lot of patients in the OPD who come to me with कि पीलिया हो गया है. And more often than not, they feel it is an infective jaundice, which could be the cause, but it needs evaluation to rule out if there is any underlying malignancy or not. So there are various types of jaundice. You have prehepatic, hepatic, and posthepatic. That is more technical, so I'll not go into that. The other more important part of the gastrointestinal tract is the colorectal cancers. So the colon and the rectum house the human waste, produce it, and excrete it. So any change in the bowel habits that is recent, so maybe there is a recent onset of severe constipation or diarrhea or blood in stools or a feeling of incomplete evacuation. All these things can kind of indicate towards the presence of colorectal malignancies. Some patients who present with a very painful lesion at the anal sphincter, that is also a possibility of malignancy. All these things will need to be evaluated well. One of the most common diagnosis that patients come to me with is that I had some blood in the stool, but a local doctor told me that it was hemorrhoids or piles. And the patient is getting on treated for piles for 6 months, 8 months, 1 year, 2 years, and not getting evaluated because they think it is piles. I don't hold them responsible, but then if any complaint of yours is not getting resolved, then I would encourage all of you to take a second opinion. Show it to another specialist or some other person so that you're sure of the diagnosis, number one. Number two, if there is any problem, that is evaluated well. So that is as far as GI tract malignancies are concerned. One very important cancer which afflicts the women of our country is breast cancer. So a lot of patients come to me saying, नहीं सर, एक स्तन में गांठ थी, but then उसमें कुछ दर्द था नहीं, उससे कुछ प्रॉब्लम नहीं हो रही थी, तो हमने इग्नोर कर दिया. Very common complaint. So what we need to understand is any lump in the breast which has been there for quite some time needs to be evaluated by at least a surgeon, better a cancer surgeon. We used to see that such lumps, such breast malignancies afflicted women over the age of 40, and younger women were not that commonly afflicted by breast cancer. But unfortunately, in India, we are seeing a lot of young women who come to us with breast cancer. So any lump that is there in the breast, please get it evaluated by a general surgeon or oncologist. It could be benign. It could be harmless, painless, small fibroadenoma, as we say. So fibroadenoma is a benign thing, nothing to worry about, but that needs to be evaluated, and you need to rule out that it is not anything other than that. Apart from a lump in the breast, you can also have some kind of nipple discharge. And let me also clarify that breast cancers are not specific to women. Breast cancers can happen in men also. And I'm sure that most of you are surprised that I'm saying this. But there is possibility of breast tissue also being present in the male chest. And we do see male breast cancers, which are actually more difficult to treat than female breast cancers, and somehow have a slightly worse prognosis as compared to female breast cancers. So apart from the lump in the breast, you can have something like a nipple discharge, which could be watery, which could be bloody. There could be some vague breast pain. There could be back pain when the breast lump has reached to advanced stages. There could be lower back pain. There could be difficulty while walking. There could be breathlessness. All these could potentially be signs of malignancy. Then we come to the other gynecological cancer, which affects the uterus and the ovaries. So unexplained distension of abdomen. So there are patients who come to me saying, उनको हमको लगता था मोटापा बढ़ रहा है, but then पेट बढ़ता जाता है. So that is actually water collecting in the abdomen. That happens when there is ovarian malignancy, when there is other sort of malignancies in the abdomen, one of which is ovarian cancer. There could be postmenopausal bleeding. So women after attaining menopause are okay for about 4 to 5 years, and then suddenly start having some vaginal spotting or bleeding. Again, and a red flag, alarming sign. So that also needs to be evaluated well. Cervical cancer is another very important malignancy that afflicts women of our country. And it is very, very heartening to know that HPV, which is the cause of cervical cancers, human papilloma virus, we have a vaccine against it. And that is usually given to young adolescent girls and can kind of prevent cervical cancer from ever happening. And it is actually a very, very important preventive measure that has been encouraged by WHO as well. And Balco is also doing a lot in this regard. All thanks to Dr. Bhavna, who has taken a very, very enterprising step to try and get this to as many women as possible. So cervical cancer is one of such malignancies which is preventable. And unfortunately, we see a lot of women from the villages who present to us in advanced stages of cervical cancer, something which was preventable. So it makes sense to put all our efforts to try and ensure that most of the people in the eligible age group get vaccinated, so that at some point we will have India, which is probably free of cervical cancer. Coming to urological malignancies, kidney cancers, urinary bladder cancers, I already told you that smoking is one of the very important reasons. And any blood in the urine or pain, unexplained weight loss, loss of weight, loss of appetite, all these things can be early warning signs. Lung cancer is again associated with smoking, so difficulty in breathing, shortness of breath on walking short distances is another symptom. Unfortunately, abdominal and lung malignancies present late. So you have a lot of lung tissue which has to get affected before it starts showing up symptoms. One example of this was during COVID, when a lot of people started getting CT scans. It actually threw up a lot of lung cancers which were actually dormant. So the patients were not symptomatic, but then we started finding more cancers. So unless the patients develop any symptoms related to anything in the body, it is difficult for them to reach the hospital. And that is why quite a lot of you might also feel that there were no symptoms. Patients come and tell us there were no symptoms, And suddenly now I have gotten this and it's in stage 4. Why does this happen? So unfortunately, some cancers do present that way, and the only way we can tackle them is to be aware of the symptoms, is to be forewarned and take steps to try and ensure that we avoid getting into the purview of cancer, so to say. Uh, Apart from this, there are bone and soft tissue cancers, which are any lumps in the body which does not go away, any bony pain that stays for a long time. Prostate malignancies, where the patients are usually above the age of 60, 70 years, men who have urinary symptoms, can have some blood in the urine and all these things. So these are the early warning signs. As far as preventive measures are concerned, I have incorporated quite a lot of that in whatever I have spoken so far. The easy and the most sure shot way of preventing cancers is to avoid the causes. One of the most common is tobacco and alcohol. Please stay away. Maintain a healthy weight. The other problem that our generation especially faces is a sedentary lifestyle. So we need to have physical activity at least 1 hour per day, which is about 5 to 6 hours per week. That should be good enough. The diet should include at least 50 to 60% of raw unprocessed food with a healthy mix of fruits and vegetables. That gives the body enough of antioxidants and essential vitamins to help combat cancers. Because cancer, one thing is that all our normal bodies, normal people also have tumor cells, but the body is able to kind of recognize them, destroy them, and prevent them from forming a cancer or a tumor. So it makes sense for us to try and help potentiate that ability of the body. When that ability of the body comes down and the tumor starts overbearing the normal faculties, that is when tumors form, that is when metastasis happens, and that is what cancer is all about. So I think, have I overshot my time? We could take questions and make it a more interactive thing. I think let's open the floor for discussion.
Sure, sure, doctor. Thank you so much for such an insightful session. I think we have some questions in the chat box. So there's one question, how lipoma is different from cancer?
Right. So lipoma is a tumor of the fat cells. So fat cells are present throughout the body. You can have it in the forearms, you can have it in the abdomen, the trunk, the legs, everywhere. So fat cells are there everywhere. When these fat cells conglomerate at one point and they form a lump, it is usually a lipoma, which is benign. Nothing to worry about. You don't need to get it operated unless it is causing symptoms, number one, unless it is painful, unless it has suddenly increased in size very recently. Otherwise, if most of us actually touch our bodies, touch the limbs and trunks, we'll find one lipoma here and there that is very normal. When these lipomas, which have been there for a very, very long time and they have not changed in character, they have not changed in the size or the shape, or there is no pain or anything like that, and there is a recent change, there is a recent increase in size, or there is a recent change in its shape, or it has started developing symptoms or something like that, that is when we have to ensure that it has not turned malignant. Although the chances of a lipoma becoming malignant are very, 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 very less. So it must be less than 1.0001%. So the only worry is that we don't miss some other tumor which could be confused with a lipoma. So if there is any such lipoma, or even there's one more counterpart called neurofibroma, which is the tumor of the nerves and the fibrous tissue called neurofibroma. These are all benign. These are all docile lumps in the body, which are there naturally, normally, through most of people. If you examine 100, maybe 60 to 70 people might have these lumps. One other thing is fibroadenoma, as I mentioned, in the breast, which is a very normal phenomenon. Fibroadenosis is again very normal phenomenon. The breast goes through a cycle of evolution coordinated with the periods. and these appearance of these small lumps is very normal. But a lump which stays, which is painless, which has increased in size, should not be ignored. Get it evaluated by some doctor who will be able to, who will be the best person to kind of advise. So lipoma, not cancer, 100%. But if there is any change, do get it evaluated. The next question is how we detect cancer at first stage. In some case, in some the case cancer detected at stage 4, and at stage 4 it is minimum chance to avoid it. So that's what I said. So depending on the organ of origin, some cancers are able to be detected early. Some cancers unfortunately get detected late. So, for example, you have a head and neck cancer, it is seen to the to the naked eye. So you are able to understand that there is some ulcer, there is some wound, there is some problem, there is some lump. So I can catch this cancer at stage 1. But if there is a cancer developing in the abdomen, that is the tummy, so until it becomes symptomatic, the cancer keeps developing. So it is not uncommon for us to find cancers who come for the first time, and on evaluation, we find that they're already stage 4. That is unfortunate. This happens very commonly in the body and tail of pancreas lesions, sometimes in gallbladder lesions, sometimes in um, intestinal problems, but very, very rarely do these issues happen in tumors of the, say, breast or esophagus or other digestive problems, because they present with symptoms. So anything that presents with symptoms can be caught early, can be caught in stage 1. Anything that may not produce symptoms runs the risk of being diagnosed late in the stage, sometimes stage 3, stage 4. In fact, in India, most of the patients end up coming to us in stage 3. So, to give you a broad outline, stage 1, 2, and 3 are curable, completely curable. Stage 4 is when the tumor has already metastasized beyond cure, but there is still chance of having a decent quality of life with treatment. So it is not like once a cancer has reached stage 4, that is the end of the journey. No, it's not like that. We have continuously evolved our treatment strategies depending on the stages, and help is always available. So don't think that a stage 4 is a death sentence. It's not. There are quite a lot of good medications. There is chemotherapy, there is radiation, there is surgery, there are so many other things. There's immunotherapy, and we are able to help our patients even in stage 4. Up till stage 3 is curable. So the treatment largely depends on what stage the cancer is diagnosed in. What tests? One second. Okay, what are the lab tests available to detect cancer cells presence? What is the range? So, to be very honest, we don't have any specific lab test which will tell whether there is cancer cells or not. There are certain newer techniques like cell-free DNA, circulating tumor cells, and all those things, which are still under research, and they have not come into clinical use so far. We have a certain set of tumor markers. For example, CA-125 is a tumor marker that is useful in ovarian malignancies. CEA is a tumor marker that is useful in gastrointestinal tract malignancies like colon cancer, rectal cancer. CA-19-9 is another tumor marker which is useful in pancreatic cancers. So we have such tumor markers, but there is no test which will reliably tell that cancer cells are present or not. And there is no, and when the test is not reliable enough, so there is no range to it. We'll have to wait and see how this evolves, and whether there is a role for circulating tumor cells and cell-free DNA molecules and all those things to have an idea about the clinical applications. Next question is what tests we can prefer to detect any kind of cancer. So again, there is no one test which will detect any kind of cancer. So please don't fall for these marketing gimmicks by lab chains and investigation houses which say whole body scan and PET scan and for everything. No, There is no single test which will tell you whether you have cancer or not. Unfortunately, all these tests will come negative, and it will give you a false hope that, okay, I don't have cancer. So please understand that if you have any issue, you contact your doctor, get a checkup done. There is no test which will tell you that you whether you have cancer or not. A doctor will be able to clinically examine you well, will be able to understand your symptoms, will be able to tell you what are the likelihood of developing cancer, especially if you have a family history. Although 80 to 90% of the cancers that we see today have no link to the family. So quite a lot of patients who come to us and say, sir, हमारे पुरखों में किसी को कैंसर नहीं था, बाप दादाओं में किसी को कैंसर नहीं था, हमको कैसे हो गया? So it's not necessary that the cancer has to be generational. So it is not like it has to be handed down through the family generations. Unfortunately, 70 to 80% or maybe more are something called sporadic cancers. Sporadic cancers is where our environmental influences, our lifestyle, all these things are the reasons why we develop cancer. It is not just because there was family history of cancer in your family. So whether there is any test that to detect any kind of cancer, no, there is no such test which will detect any kind of cancer. If you have any symptoms, specific tests can be done to understand what stage it is in, whether it is present or not, and then take treatment according to that. So please don't go and get a PET scan done if you're a healthy individual. Please don't go and get a CT scan done. All these are tests expose you to a lot of radiation, which actually can be responsible for developing cancers. So I know of some people who get yearly CT scans and yearly PET scans, completely normal, healthy individuals. It is dangerous. It is dangerous because these scans have high dose of radiation, which should not be exposed to a normal, healthy individual. So please don't go around getting tests to rule out cancer. If you have any doubts, any problems, please consult a doctor, a general surgeon, or an oncosurgeon, or even an oncologist for that matter, anybody. They'll be able to accurately tell you whether you need these tests or not. Briefly tell about Russia's cancer vaccination. So it was there in the news that Russia has developed some vaccine against cancer. Although more details are needed because none of us have really used it, neither seen its efficacy. There needs to be scientific publication, there needs to be human trials, there needs to be a lot of things until it comes out for routine human use. Until then, it will be difficult to talk about Russia's cancer vaccine. A lot of research is going on across the world to develop some sort of a remedy for cancer. And I'm sure in the years to come, we should be able to have some breakthrough due to which cancer can be prevented. Because for treating, we already have enough uh, options available. Just give me a minute. I'm getting an important call. Hello. Sorry for that. Just getting a call from the OPD. Okay. Chemical in healing can cause cancer. I'm sorry, I didn't understand this. Praveen, could you please explain your question? Chemical in healing can cause cancer. Praveen Vaidya is there. Please type in the clarification for your question so that I can answer it better. Meanwhile, I'll go to Shonita's question. Does cyst going forward lead to cancer? Very, very unlikely. Again, it depends on where the cyst is, but a cyst turning malignant is very, very unlikely. We do know ovarian cysts can, again, very rarely lead to malignancies because there is an entity called ovarian cyst adenoma, which can turn into something like a cyst adenocarcinoma. But again, the chances of that happening are very rare. Usually, these cyst adenomas they grow to a very large size and they are usually benign, so the chances are less. You mentioned water accumulating in abdomen in case of ovarian or uterine cancer, how to approach for diagnosis. So once the complaint is evaluated well by the doctor, what we usually do is we get an imaging test. So imaging test is usually an ultrasound or a CT scan or a PET scan or an MRI, depending on the clinical suspicion of the site of cancer. And then we get a sample of that fluid that is accumulating in the abdomen, get it evaluated to check for the cells, if there are any cancer cells present. If there are cancer cells present, we are able to identify what is the origin of that cancer, whether it is from the ovary, whether it is from the appendix, whether it is the liver, wherever it may have come from. So that involves putting a small needle in the abdomen and taking a sample of fluid, and that is evaluated, and cytology is done. So we understand where this cancer might have come from. Continuous body pain, especially leg pain, not reason of overweight, can symptoms of cancer. So body pain, leg pain are very common symptoms, to be honest. So even I have body pain, even I have leg pain sometimes. It is mostly due to overwork, mostly not due to cancer. But you have to see it on the whole. So something like a continuous body pain in the back or the lower back, associated with loss of appetite, associated with loss of weight, associated with listlessness, maybe little depression, associated with inability to eat, associated with having some blood in stools, then it becomes significant. Standalone continuous body pain may not be a sign of malignancy. Maybe you can try some symptomatic treatment and get that should help. My mother is taking injection zoledronic acid. What is the use of this and the exact frequency for this injection? So zoledronates are belong to a class of medications called bisphosphonates. Bisphosphonates are actually drugs which help bone formation. So, but we also found that in breast cancer patients, zoledronate or bisphosphonates have deliver a survival advantage, and that is why zoledronic acid is advocated, especially in patients who are postmenopausal and who are on hormonal therapy. So this is the use. Postmenopausally, the bone mineral density also comes down, so the bisphosphonates help in that regard as well. So usually calcium tablets are also advised, and that helps in keeping the bone mineral density up. Also helps in improving breast cancer prognosis and survival. Exact frequency for this injection, usually it is given in about in 100 ml NS. So that is usually about 6 monthly injection. But again, it is individualized depending on the treatment that the patient is undergoing and what tumor characteristics are there. The best answer to this would be the treating doctor who is giving treatment to your mother. I think that would be the right person. X-ray done yearly could lead to cancer. So chest X-ray has very minimal exposure to radiation. It is about 0.001 millisievert. So that is not sufficient in itself to cause cancer. Mammography or a CT has significantly higher radiation, although mammographies are safe. Yearly done chest X-ray will will mostly not lead to cancer, but I am not sure why Mr. Ramchandran is getting yearly X-rays done, unless you have been advised by the doctor to as a part of some follow-up. I don't think you need yearly X-rays. If you have any issue, then that should be evaluated well. But addressing your question, X-rays don't really lead to cancer formation as such. Any chemicals, especially industrial chemical fuel? Yeah, okay, got your question. So yes, a lot of chemicals, industry chemical fumes can cause cancer. Varnishes, especially asbestos, which is one of the reasons for mesothelioma of the lung. So it's a lung cancer. It's a type of lung cancer. Quite a lot of individuals exposed to cotton industry can have bisonosis and berylliosis, and all they can lead to cancers. Aniline dyes are another such chemicals which are known to kind of be implicated in cancers. Um, Painting industry also uses a lot of cancer causing chemicals. So yeah, if you actually these are some of the examples that come to my mind off the top of my head. If you would like more detail on this, you could just probably contact me and I can give you a list of the chemicals that are known to be implicated in cancer. And if you happen to be exposed to any of these kind of chemicals, I think you should take adequate precautions. It is done as part of periodical medical examination. Mr. Ramchandran, okay, that is fine. So a chest X-ray or an abdominal X-ray done yearly is not a problem. That's not going to lead to cancer. The amount of radiation that you are exposed to due to a chest X-ray is very, 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 very less. So that's fine. Any other questions? I would be happy to answer.
Yes, doctor, there was one question that got missed out. It's from Vivek. So he's
Okay.
asking, is there a recommended age range for taking the HPV vaccine, and are there any known side effects of that vaccine?
Right. So what is recommended is from the age 9 to 19 is there's a single dose of cancer with the vaccine available. From 20 onwards till 45, also for women, the cancer vaccine is advised. However, it is most efficacious when given to young adolescent and young girls. This is because the maximum efficacy that was seen was prior to the first sexual encounter, because the HPV infection or the colonization happens after the sexual encounter. So the vaccination done prior to that is actually the most efficacious. So if you have your sisters or somebody in the house who is in the age range of 9 to 10 of sorry 9 to 20 to 25, then I think they would be the best suited to receive the cancer vaccines. Although please consult your doctor. Age will have to be evaluated, and then whether you're eligible for the vaccine or not can be decided.
Thank you so much, doctor, for sharing such a valuable insights with us. Your expertise and guidance have made us more aware
Yeah.
and better equipped to take preventive steps against cancer. And a big thank you to all our attendees for being such an engaged audience. And let's take today's learning forward and spread awareness among our friends and family. So, thank you all.